Welcome to the NorthLakes podcast. I'm Jeremy Oswald, and in this episode, I speak with Dr. Rena Christman about pediatric dental, things that parents can do to help kids brush, and I find out what's in her car. Dr. Christman is a pediatric dentist at NorthLakes Community Clinic in Eau Claire. This conversation took place in Eau Claire, Wisconsin in April of 2024. Here we go.
My name's Rena Christman. I'm a pediatric dentist, and I work in the NorthLakes Eau Claire Clinic on the Hastings Way campus.
Right, which we're about to add, like this week, a new branch.
That's right.
Our new clinic.
It's pretty exciting.
I was just over there hanging up signs, so that's why I'm in town today.
Awesome.
What is pediatric dental specialty? And is that what it's commonly called? Am I saying that correctly? I think that's what we call it here at NorthLakes.
We do. In the past, many years ago, it was pedodontics. That was the study of and the practice of pediatric dentistry. Like in the 80s, it changed to pediatric dentistry as a better descriptor for the profession and for the work we do. Yeah, and you know the work we do is basically taking the knowledge that kids are different. They're just little growing beings, and they are developmentally, emotionally, neurologically changing all the time. So the need for the specialty comes out of that sort of purpose. We want to have sort of early intervention with the families, making sure they understand why that is so different. And then also going forward, just making sure that we're following them with longevity and making sure that we're pointing them in the right direction at every stage of growth.
So what are some of those differences? Like what is it? How am I different as a 52-year-old man from a 8-year-old person?
Absolutely. So we know different stages of development. We have different cooperativity levels. So probably from the age of 0 to 3 years old, we call that pre-cooperative. I mean, don't get me wrong. There could be some adults that are pre-cooperative.
Yeah, mine went until about last week.
Yeah, exactly. Right. Mm-hmm. So it is definitely spectrum. Mm-hmm. So there are like known cutoff ages, but we never take that as a hard and fast rule of any sort because we know it's a spectrum. You could have a 10-year-old that is unable to be able to sit for dentistry. And you could have a 4-year-old that's just sitting there watching the TV and doing everything. Mm-hmm. So we just take it as sort of a suggestion, quote unquote.
Right.
And then we know where to go from there.
So it's not just the what's actually happening with someone's teeth. It's the how that care is delivered.
Correct. It's how it's delivered. It's how the child is considered as a whole, how their family's idea about dentistry brings them to the place they're at. Understanding what that means. That could mean some fears that the family has, or the parent or the caregiver. That could mean we don't think that baby teeth are important, possibly, or that was given very much relevancy in their young life as a kid. Definitely, lots of things go into the guidance and the help for the family and the child with the oral health and helping them understand how do we go about taking care of the dentition, but not just that. What does it mean long term? And it can mean a lifetime of really excellent health, or it could go the opposite direction.
And unfortunately, the dental care's got a stigma about it, and I don't think you would shy away from that. And
no.
It's too bad. I mean, some people are just afraid of the dentist.
Absolutely. I can't even count on two hands over and over again how many parents say to me, my experience was different. Mm-hmm. And it wasn't what you're doing today for my child. Mm-hmm. A lot of it revolves around pain and cavities and infections. And so that's what we hope to do, as we go forward, is make sure that we help people understand that not coming in is the wrong direction. And we can hopefully redirect the energy to a positive place through education.
And so, are you able to like share any of your techniques? Like when there is a scared little one comes in, like what do you got some secrets you want to share?
Yeah, absolutely. I mean, I think
They're not secrets, but
No, but definitely. There's definitely some way of going about things that's different, maybe for pediatric dentistry, because we see scared kids all the time. One of the things to do is you as an adult know too, if you are trepidatious or don't know what's going to happen, you're going to be more anxious in any situation. So the first thing is we call it tell, show, do. So everything from the cotton or the 2x2 cotton or the cotton rolls to our air water syringes to our suction, we are showing them, every time they come in just about, what it's about, what's the noise, that it's not going to be a scary thing at all. And by the second or third appointment, a lot of times they're like, but no big deal.
You're taking away a little bit of the mystery.
Yeah.
Because, dentist offices, where you work, operatory, I think is what you would call them. Mm-hmm. They're unique places. Like you got stuff in there I don't see anywhere else.
They are. Mm-hmm. And the cool thing is if you can make it less of a mystery, they become curious about it. Mm-hmm. And then they're like, they want to use the water and the air and the suction, and even at times I'll just say, well, you hold the suction now because I'm going to do some water and you can suction it out yourself. And, that helps them too to understand that not scary at all, just noisy. Mm-hmm. And we have kind of some weird smells, some weird tastes for sure. So, sensory issues are definitely a thing. And we've probably come to a point where we're more aware and it's more reported that not just kids, but adults have sensory issues regarding taste, smells, textures.
Lights. Yep, lots of stuff. I was happy to hear you use the word baby teeth because I was coming up with my questions for you and there's got to be like a more fancy word than baby teeth.
Definitely. We call them primary teeth.
I like it. Okay.
In adult teeth, I would say we call them permanent teeth. But we typically use whatever language the family's comfortable with. And I'm happy to call them, some people call them milk teeth.
Ooh, okay.
It's a different one.
What are some others? Are there more? I like milk teeth. I might start just using that in my day-to-day conversation.
That's a funny one. Mm-hmm. Right now I can't think of any, but there's definitely some different ones that you hear. And descriptors for all dental things.
Yeah. And here's me. I don't know what you do, and that's why we're doing this, and that's why I'm
that's awesome.
It's not just the behavior or the coaxing someone in a child to be comfortable. What else makes you different than I hate to use the word regular dentist or than a dentist?
It's
if there is a difference, I assume. Yeah.
Here's the thing: when we get down to the actual clinical portion, that isn't very different. Some of the materials I use might be different because we know that these teeth have to last for many, many years, until we do have our permanent or adult teeth. So the materials might be different, but the actual dentistry is very much the same as a non-pediatric dentist. Mm-hmm. I would say most of it surrounds being able to pick out what are the needs. So is the child actually scared? Are they mad? Are they, fearful of new situations? Or is it just maybe it's the smell, like I said before, or maybe it's, I don't like the taste of that thing or whatever it is. It's kind of the ability to pick out what those typical things are and specific for that child. So what are the unique needs of that child? And we focus on it more because we're just treating a lot of kids.
Mm-hmm. So would a typical, and I know I hate to use the word typical, but I'm going to.
You go right ahead.
Oh, thank you. Would a typical child coming your way perhaps has gone to another dentist and it was just like, this is not working out. You got to go see Dr. Christman.
Yes, that could happen very often. Mm-hmm. What we see is, in a general practice, we see families from 0 to 100, but we might not see 10 kids a day, or we might not see 20 kids a week. So it's just frequency, really, right? Because I'm seeing them daily and hopefully every 3 months. That's our goal.
You specialize in it.
Yeah, exactly.
Specialist. Speciality.
And so if they've gone to mom and dad go to a certain dentist or a certain clinic and they've tried an appointment or two there, then they might say, okay, let's try and see if we can make it work better in a pediatric office. I mean, we do have some bells and whistles, right? We got toys, we got gold coins, we have TVs, and we have our team that's specially trained. And I gotta give a big shout out to my team, because without them, my work doesn't get done. Our team is specially trained to do the things I do in getting kids comfortable in the chair.
Well, for what it's worth, when I come visit your clinic, there's a great vibe in the building.
Oh, that's awesome.
I don't know.
I love to hear that.
Marketing term, but it's always, everyone here is nice to everyone, not just kids.
Yeah, we really want to have an upbeat and kind of exciting place for them to want to go.
Nice.
Yeah.
So you kind of talked about this just a little bit. What might be some other motivations or reasons a parent might want to head towards a pediatric dental specialist?
We like to see them earlier. So we say by the time their first tooth has erupted.
Milk tooth?
Well, you say milk and I'll say primary.
Okay, that's
by the time that first one has erupted, or by 1 year old, we want to see them. Because what we know is that it's not just about the teeth, right? We know that there could be some different things about the growth and development that we could identify early, and possibly that would be something that the parents would need to know. There may be some structures in there that are different. The gums.
What do you mean?
Might be.
What are structure?
Yeah.
What does that mean?
There are kind of some bumps that we could see on the gums that might be something that's not average. Something that might be what would be considered sort of a pathology. We might also see, so if we see a child that is developing and erupting certain teeth at certain times, and then we notice something's out of line, that could be a real indication that something's happening.
And I'm going to guess with everything, the sooner you catch it, the easier it is to provide care.
Absolutely. And that's one of the big sort of the buzzwords we use is anticipatory guidance. So it's basically we want to find out things ahead of time as we go through those developmental stages, so we can give mom and dad the tools that they need at each stage. And if there are these things that may be non-average, let's intervene early if we can.
And again, is it, will you see a child be the first dental care they get? It's not all, as I was thinking, living in my fantasy world, that they go to another dentist and then they come to you.
Yes.
Sometimes that happens, but sometimes you're the first.
Absolutely, yes. Okay. So especially with families that already have a dental home with us, it's really typical for those little siblings to come into play right away. That's their first experience as well. Right.
And I just want to touch on this just a little. And we spoke a little do we even want to ask about this? But sometimes it's really hard to get a dental appointment, not only here at NorthLakes, but anywhere.
Definitely hard.
What's your quick 2 cents about that?
I say the need is so great. I feel like it's, there just isn't enough of us to go around. The other thing I would say is if you have a dental home, attend. I say go to that 6 month, go to that 3 month appointment, whatever that is. Make sure you're doing your your recall appointments and sticking with them. Make sure you are keeping them busy and they're watching over you.
Don't slack off on an appointment.
Try not to. Yeah.
Somebody else really wants that slot.
Yes, and that's a lot of times what happens is we'll see, especially the parents come in, and luckily we now have Dr. Luke with us.
Yes.
She's seen our adult parent patients.
That must be great for you.
It's exciting.
I mean, Dr. Sarah Luke,
yes, has
recently begun here at this clinic.
Yes.
I know I got really excited when I got another marketing person because I can talk about Photoshop and that kind of stuff. I imagine it's the same for you.
Oh, so great. I mean, having a collaborative relationship and just being able to bounce things off of someone is always a better way to practice than a solo practice, in my opinion.
Mm-hmm. And the other kind of neat thing that's happened here, and it's I know your history, like you were kind of, I think you were kind of, seemed like you were off on your own and like in Chippewa.
Absolutely.
I'm totally spacing the name of the town you were at. Chippewa Falls.
Chippewa Falls, that's right.
Now you're here, and there's behavioral health therapists here. There's a community health worker here. Have you been able to collaborate with them, or what's that like having them in the building?
That has been incredible because, as we know, behavioral health needs are great. Community health worker needs are great as well because lots of people don't know where are the resources for what they need. And we're just so fortunate here to have that right at our fingertips, basically across the hall. And our families have been so thankful to have that.
And I mean, great in so many ways, like one-stop shop in a way, like
absolutely.
Got this appointment, and then yeah, there's lots of great things. I don't need to list them off, but I get excited. It's always fun for me working here to come into a clinic and actually see the work that you guys do, you people do, and it's so sorry.
It's definitely it's a living being. You know what I mean?
Yeah.
And it's always. I mean, I love my work, so. Mm-hmm. I hope it shows.
Yes. So they're, here I'll just write the way that I wrote this. I'm going to, we agreed on some questions beforehand.
Yeah.
And when I wrote out, I'm guessing that there are a lot of options for dentists in the world. What made you choose to work in a community health center?
My former practice was with my husband. And when he retired, it was, like I said, collaborative work is always really fun. I also have always been a practitioner. I see all payer types right in my clinic, and my mission fits with NorthLakes' mission. We want to have access for all patients. We want to make sure we're able to get, in my opinion, the most vulnerable patients are the children, right? And I think that just being able to expand that in such a way with NorthLakes has been just exciting because the need is obviously so great and such a mindset that's so like mine. It's really great. Mm-hmm. I've loved it.
It's a good fit.
It is a good fit.
Good fit for you.
Absolutely.
Awesome. So let's see. So, what are some of the other challenges with the treating kids? Like, and I'm going to like the big one, like, I don't know, big one. Well, yeah, I'll let you answer. I'm not going to pretend to know.
I think the challenges are knowing that there are still so many areas where kids can't get care. To me personally, as a pediatric dentist, it's so, that's a challenge just because I want to help everybody and make sure everybody has access. And that's super challenging. What's challenging for the families is because they can't maybe get care in their immediate area, sometimes they have to drive. They may have challenges because maybe they have transportation issues, lack of transportation.
Parents probably got to take time off of work.
They do.
Come to the,
absolutely, and that's a big one. Like we got to work around the work schedule. Is there somebody else in the family that can help out? Many times they do. They have grandparents or aunties and uncles that can help, but sometimes it's just the mom or the dad. Mm-hmm. Yep.
And there's got to be a lot of rewards too.
Oh my goodness, so many. It's just really a fulfilling experience to be able to help families. I mean, they come to us with a lot of times just an open mind on what's going on with the child, what are the child's needs, what are the, is there anything that's going on that's, infection, is there cavities, or I might not even know why the cavities are there. Every day is new and exciting because it's really dynamic. You just don't know what's going to happen. I think the families are really grateful to have a place to land and a place to get good information.
Well, if, I've been out there in the world and not had great experiences with medical care in general, any kind of care. And like, you're kind of like, boy, I didn't really like that experience. And knowing the little bit I know about you and us, like for somebody to like care and like take care of a problem and in a problem that's like pain, I mean, what a relief.
Yes, absolutely. I mean, if you think about it, that child's being uncomfortable, it's got to be like the worst for a parent. I mean, there's nothing else that could be worse than knowing that your child is uncomfortable or in pain. And so being able to help them, kind of put that sort of to rest. I mean, that's an incredible feeling. The other thing is to help them also to understand that I don't want to be here to dictate to them what to do. I want to give them the knowledge to make those choices on their own as time passes. And then also just to know that the team is not just myself and my dental team, it's the child and the family also. So make sure they understand that those are decisions that we make together, not as not in a vacuum. Obviously.
No, well, I mean, you want the buy-in. You want it to be a partnership, and that's going to work better than like, you better do this or else.
For sure, yeah. Yeah, there's no other way to do it.
Although that did work with me with flossing. I was like, I don't want to have to deal with that again. I got a better floss tonight.
Oh, that's good. I love it.
Yeah. It took a while, but yeah. So let's just like talk about just maybe like oral. Is oral health the way to say it? Oral
it
health?
Is. Oral health.
All right. Yeah. I'm like osmosis. If I'm around it enough, somebody will come out. So what are some good tips to get their parents that you can give to parents to give their kids to get start good brushing habits? Yeah.
So I always say make it fun. And, kids want to do anything fun or exciting or different or, they're just so curious naturally. Make it so that you're doing it with them. I always tell families until they're about the age where you would let them wash dishes and you would eat off that dish, that's about the time when they can brush their teeth well enough to keep cavities away, okay? So it's very much longer than parents think. So we say, let them do it all themselves, help them put all the fun things in place like the magical toothbrushes and the videos that show about brushing and play their favorite song until they're done brushing. Let them do it, but then when they're done, the parents have to be really involved until that age, whenever that is.
And when do you start flossing? Like when, like, I was like, when? Like day one, like home from the hospital? I guess they don't have teeth yet. So when should somebody start flossing?
When the teeth start to touch. So that's different for every kiddo and it's different for every person in general because some people just have spaces between all their teeth for a long time, right? And you could actually brush well enough to keep those spaces clean. So flossing is maybe down the road a little bit. More likely, though, we see children where the teeth are touching or they're overlapping. And that's when you start. When you see those teeth touching, that's your clue.
And I know not every kid is different, but like, how do you like start that? I mean, like some parents gotta be saying, I can't even like get them to brush. Like now you want me to do this thing too?
Absolutely.
Can you tell I've had a flossing thing? I mean, I don't mean to make this about
You are not the only one. Let me tell you, that is like one of the main sort of things to get in your routine. That's not the easiest, I would say. Definitely. Yeah.
How do you get kids to do it?
So flossers are kind of a miracle thing. They're just like, they're made in the shape of a dinosaur now, or they're made in the shape of a hippopotamus, and they're a little handle with a little piece of floss on them. Oh. So it's super easy for the child to start to learn how to do it, and then it's super easy for the parent also to do it. So making it a little bit more fun. I just will go back to how do you get kids to brush too? Yeah. Get that as a routine, right? So you're already doing things like you're going to bed at a certain time, you're getting up at a certain time, taking a bath. Brush and floss and just make that part of the whole package. You know what I mean? And the sooner you can, even though they don't like to do it, you might get part of it done. Whatever that is, and it's within your abilities with your child at this point in their life, that's what you do. And just keep building on that as you go.
Yeah, this is part of our life. This is
Absolutely.
What we do.
Yep.
Well, other than the brushing and the flossing, I mean, those are always kind of what we hear. Are there other good oral health habits that we should all be doing, especially kids?
Yes. Dietary guidance is so important. Right, from the time that we saw diets change, and I think it can be kind of related back to when our parents went back to work, when mom wasn't home with the kids anymore, the diet kind of changed. More fast foods, more foods out of the freezer, a lot of foods that were amended with corn syrup and sugars that were kind of hidden. Part of the normal diet now might be soda or diet soda or drinks that are just diet drinks in general. It's kind of a trick because I think a lot of families that hear the word sugar-free or, like it's got fake sugar in it, they think, oh, that must be healthy. But it's kind of a trick because they amend it with an acid typically to make it taste yummy or to make it bubbly. So the one that makes it bubbly is carbonic acid, and the one that makes it taste delicious is citric acid. So the acid works in the same way that the sugars do. So even though you might be having a low sugar diet, if you're having a high acid diet, it can work in the same way that the sugars do. So
still going after your teeth.
Yeah, absolutely. So kind of that's the thing to kind of keep in mind is try to go for the natural foods whenever you can. I always say cavity bugs don't have any, they don't care what the sugar is. If it's natural sugar and it's a lot, it's still going to make a cavity. But I mean, natural foods are not as likely to stay on the teeth maybe. I would say also always drink water. And if you're going to do a non-water drink, do it only at a meal. Because when you're chewing and eating, you have more saliva, and the saliva is protective. So keep that in mind. And absolutely the one thing that is one of the saddest things to see is when we're given a bottle with any kind of drink that's not water. A bottle or a sippy cup at night or during a nap. So keep away from those ideas too. Really water only in those cups if you're going to do it at night or at a nap. Yep. A lot of the sports drinks now, though, that's a big deal, too, because lots of kids are in sports, and that's really a big push by, of course, those companies. And then, it's considered healthy, which I'm not saying it's not. It can be. But also you have to remember that those have all those acids put in them, too.
So let's say I drink one of those. Do I maybe, brush my teeth right away? Do I wait until night? Or what? If I wanted to be I want to have good teeth, but I'm also going to drink this.
Absolutely.
What should I do?
There's a way to do it.
Yeah.
So you don't want to sip on it. If you're going to open a drink and you want to have a drink that's not water, drink it down in one sitting. Also using a straw, it bypasses the teeth somewhat. Okay. The other thing is drinking water afterwards. So say you're out in the community, you're going to an event, you're out at a restaurant, drink some water. Another good way is to chew gum, believe it or not. So any gum with the first ingredient, that's called xylitol. And that's a sugar that bacteria don't like. So it helps to actually decrease the likelihood of cavity bugs being a problem.
Got it.
Yeah.
Okay. Well, hey, we're helping everyone here today. All right. Excellent. You kind of talked about this a little bit, but what do kids ask you? What do they like to talk about? I mean, I know it's kind of hard to talk to someone when your hand is in their mouth, but what do kids ask you? They
want to know everything. And especially if we miss something in the tell, show, do portion of the program, right? But yeah, they want to know everything. They want to know what this is and what that is. They want to know what kind of movie they're going to get to watch, right? And
Bluey I was told there was a movie.
Bluey is big. We're loving Bluey. We love Marvel. They want to know, they'll tell us all about their parents, which their parents may or may not appreciate. Their mom and dads do or don't brush or do or don't floss, or you know what I'm saying? It's super cute. They're so curious and so honest. It's just there's every day is different. There is no way to predict what's going to come out of the mouths.
No,
for
that's
sure.
got to just make it everyday fun.
It is fun.
And
it's
then,
really fun.
like you said, being in this room, being in this building with you guys, it looked like you all have a very fun time together. Once they leave, you must all have a good.
We do.
Oh, do you believe what you just heard? That
definitely, because being in the proximity we're in the clinic, pretty much everybody could hear everything, right?
Yeah.
So it is kind of funny because everybody's like, oh my gosh, blah blah blah. That was a hilarious.
Right.
Thing that child said.
So you must not have favorites, but you could. There got to be like, oh, Ralph's coming in today. Not Ralph is a fictitious name.
No, it is totally. Yes, absolutely. Because, so many unique personalities. And it might be because of like what they ask every time they come in or what they tell us every time they come in. Or, they might have their own routine. They get in the chair, they want to get situated in a certain way, or we have little pillows that they can go under their legs or a blanket, or they may want the pillow and the blanket, or, just whatever their routine is might be something interesting and fun.
But as they get older, like you see like teens, right?
We do.
So like they're like, I'm no longer a blanket patient.
100.
Like, yeah.
The evolution is so fun. Yes, because it's definitely like, from the maybe possibly, a little bit scared little kiddo to the, the middle-aged kiddo that's like, I'm fine and I'm doing this all myself, and to the teenager that's more quiet and not as likely to blab about stuff.
So I get this is a total weird tangent here.
Yeah.
So I take senior photos for kids
sure.
Outside of this NorthLakes thing. But I think you and I might have something in common where you get these kids for an hour that you don't like. I'm not hanging out with a 16-year-old. And there are a lot of times they're kids I've known, for a long time since they're very little. And it's so fun to have that hour with them to you don't usually get. And I'm just guessing you kind of experience that as well.
Absolutely. Because when you hit on the thing that they're interested in, it's like a fire under them. You know what I mean? You can just see their eyes change, their demeanor changes. And that's the thing you keep as your link going forward, because what is it? Is it Legos? Is it dinos? Is it stuffies? Is it...
they played soccer or whatever.
Right.
Like that video game, just to be able to have that connection and develop that relationship. Huh.
Yeah.
What do you think? You touched on this a little bit as well, but what are some unknown barriers that kids have to getting dental care? Mm-hmm.
I think here's the thing that's so different about a child. They are, it isn't their choice or their motivation that can get them into an appointment, right? They have to rely on their caregiver. Or their parent.
They're probably like, no, not my. Yeah, it's not my job to schedule.
Right? Yeah, and so. If a child doesn't have a dental home, they maybe will see somebody in outreach, and that's what we're lucky to have, because our outreach people in the schools are incredible, our hygienists and dental assistants out there, and they get us back to them.
Do you want to just explain that a little bit? I'm sure a lot of people know about it, but...
So we have a system in place where we have dental assistants and dental hygienists that go out into the schools, and they do hundreds and hundreds of exams and fluoride treatments a year. And so it's a great way to get them back to me if they don't have a dental home, or if they have had one in the past and maybe they don't now, to get them back to me to get some care if that's what they are in need of.
And NorthLakes is the largest program in the state.
That's true.
Yeah, just massive.
Massive.
We got vans that they're just all over the place in the schools.
Yeah, it's incredible.
And I can't remember the name of the person that I interviewed for the podcast, but I did do a podcast on it. So if you're a listener interested, look back in the feed. There's a whole other podcast all about it, and it's a great story.
I'll have to go back and listen to that one. That'd be fun.
I thought you said you listened to all of them.
I missed that one. Jeremy, I missed that one.
Sorry. How does a healthy mouth affect a child? How is that helpful to them?
Overall health is really affected by your oral health. And I think as we learn more about that, just in research, and we know now that it affects your cardiovascular health. It can affect your reproductive health in some cases when you're an older person. We know neurologically it can affect your health. One of the really good examples I can think of where oral health becomes such an important part of a person's life is if we become diabetic. Those people, we want to avoid any sort of inflammation, and inflammation in the mouth will definitely exacerbate their disease. We're seeing diagnoses earlier. Now we know that there's lots of kids out there that have diabetes at an earlier age now. And so a lot of the kids I see that have diabetes, we just got to make sure that the families know brush and flossing isn't a choice for your kiddo, because they're going to need that, their whole life. We're not going to somehow maybe cure that diabetes, but we can help keep them healthier through good oral care.
Mm-hmm. And I think I derailed you when we started talking about our school program, because I had asked you about the unknown barriers. So
yeah,
I distracted you, and I don't know if I let you finish that question.
No, that's okay. I just feel like I was saying, I feel like it's so out of the child's hands for them to be able to get to someone. Mm-hmm. And if you're in a school where we don't have a program, that's a real disservice to the child also, because they will never have somebody that will realize they need care until pain, swelling, infection starts. We do have emergency services in hospitals, but we always say we really want to avoid that, because that should be the last resort for a child to be able to just access that as their care.
Yeah.
Yep. Okay.
Are there things a parent can do before an appointment that makes it easier for the kids and for you and for them? Like, do you have any suggestions for parents, like pre-appointment?
Yeah, absolutely. I think if they have already set up a system where they've got brushing and flossing going on, even if it's just sometimes, that's already ahead of the game. In a child where there's been absolutely no brushing and flossing interventions, and then they come to us as an older kiddo with pain and possibly infection, that's a real, we're kind of coming at it from the back door for sure. So if parents, are doing those things at home, like putting that in their routine, that's one of the biggest things they can do. Making sure that the food and the drinks are healthy.
And I bet, I don't want to, I hope parents aren't making you the bad guy, bad person, but like when they're trying to establish those brushing habits, I wonder if they you don't want to make Dr. Rena upset, so you better brush.
Sometimes they do, and that's okay with me. Mm-hmm, okay. It does work in some cases, especially after we've gained some whatever relationship, they want to do that. They're very naturally want to do that thing, whatever it is that's going to make something good or better. You know what I mean? The other thing I wanted to mention was sometimes in the case of kiddos that are nonverbal or on some type of a neurological spectrum, they also can start by using pictographs. So just using that as sort of a guide. Here's what we do for brushing. Here's what's going to happen when you go to the dental office. There's several books out there that are really do a good job with it. And it's just very simple. Like, what's the symbol for brushing my teeth, and here's the dentist, and that kind of thing. It really does help the kiddos, because they are very motivated by a visual cue rather than a verbal cue. Yep.
I love it. I got one last question for you. What's in your car right now?
My water cup.
Okay.
Super exciting.
Yes.
What else is in there? My sunglasses?
Mm-hmm.
There's not a lot in my car, Jeremy.
That's fine. That's fine. I recently got a new car at a car for a long time, and I kept a lot more stuff in my old car, and now with my new machine,
you try to keep it.
I'm like, does that need to be in here? I don't think so. So
no,
anyway.
Every day you gotta go through it and say what really has to stay.
Yes. Anything else?
No, but thank you for coming today. It was fun to talk with you, and hopefully give some information that maybe somebody hasn't heard and that might help them in some way.
Yeah. Okay. Well, Dr. Rena Christman, did I get it right?
You did. Awesome.
Dr. Rena Christman, thank you so much for being here. I always love talking to you. Thank you so much.
Ditto. Thank you.
Okay. Have a good day.
You too.
All right. Bye.
Bye.
Thank you for the conversation, Dr. Christman. Dr. Rena Christman is a pediatric dentist at NorthLakes Community Clinic. NorthLakes Community Clinic is a federally qualified health center with locations throughout northern, eastern, and western Wisconsin. NorthLakes' mission is to respond to the healthcare needs of our communities with an integrated array of quality services and actively remove barriers to wellness. find out more about what we do on our website, nlccwi.org. My name is Jeremy Oswald, and I am a marketing and communication specialist at NorthLakes. Currently in my car, I have an umbrella, a sweatshirt, a camera tripod, and one of those circle reflector things that photographers use. Please give the NorthLakes podcast a review on whichever format you are listening, or share it with a friend. Thanks for listening.